So welcome to the Center of Excellence for Infant and Early Childhood Mental Health Consultations Conference and Equity from the Start. My name is Sarah Davidon, and I will serve as your session moderator today. I'm joined by Chris Ward, who will serve as your technical host today. This session is being recorded and transcription will be available through our platform. If you should have any questions, please feel free to relay your questions in the chat. And we're going to allow time at the end of the session for questions and answers with the presenters. So that said, I would like to pass it over to our workshop presenters today, Ali and Christine, and they'll give a fuller introduction of themselves. I will just want to let all of you know that we'll allow 10 minutes of questions and answers at the end. So if you don't have a technical question that needs to be answered right away, we'll save your chat questions till the end, and I will go through the questions with our workshop presenters at that time. So thank you very much, and Ali and Christina, I'll turn it over to you.
Great, thank you so much, Sarah, and thanks everyone for having us. You are here for Seizing the Moment, using policy to leverage funding to advance infant and early childhood mental health consultation. We'll probably be using just the phrase consultation throughout the presentation, but when we refer to that, we mean infant and early childhood mental health consultation. It's not now advancing my screen. One second. Restart that. There we go. So we'd like to start with a land acknowledgement, and we acknowledge that as we all come together from across the United States for the Infant and Early Childhood Mental Health Consultation Conference, the majority of us live and work on unceded tribal lands. We acknowledge the history of genocide and forced removal from this territory and honor and respect the diverse indigenous peoples still here. These genocidal acts of settler colonialism extended to peoples of Africa and their enslaved descendants, and we recognize that the vestiges of slavery remain present throughout the United States and directly affect the descendants of enslaved peoples. Our country is home to millions of people who identify as Black, Indigenous, and people of color, who are actively advocating for sovereignty, self-determination, equality, and justice. We fully support our friends, colleagues, and peers who identify as Black, Indigenous, and people of color in that work and are committed to reaching a deeper level of understanding, engagement, and allyship. We encourage you to visit Whose Land and nativeland.ca to learn more about the Indigenous peoples and history of the land where you live and work, and also the 1619 Project to learn about the consequences of slavery and the contributions of Black Americans.
Thank you, Ali, for that land acknowledgement. As was mentioned, my name is Christine Brambilla, and I'm the Infant and Early Childhood Mental Health Consultation Manager. But before we dive into the content, we wanted to start with some reflective thinking. Native American tribal leaders across cultures have long linked health with these four simple questions. They believe to understand the problems with one's well-being, we must first ask the unwell individual, who are you? Where did you come from? Why are you here? And where are you going? On an individual level, tribal leaders believed our health or well-being is linked to the stories surrounding our lives. So, who are we, and what might be some of the lenses we see and experience the world through? I identify as a cisgendered woman that is multi-ethnic, Polish, Irish, German, and Mexican American. I did not grow up speaking Spanish, but I learned Spanish as a result of my education and study abroad experience. I'm a disruptor of intergenerational poverty and trauma that my mother and grandmother survived. Where did I come from? I was raised on the south side of Chicago in a predominantly African-American community and received a scholarship to a boarding school in Massachusetts at the age of 14. As a result, I learned very early on how to be comfortable with being uncomfortable. During my study abroad experience in Nicaragua, I was confronted with the harsh reality of the privilege I experienced growing up with a single parent in a low-income household on the south side of Chicago, because I am simply a US citizen who can read in one but not two languages. And why am I here? The best learning occurs through an exchange of ideas and lessons learned from past experiences. We want to share how we are seizing the moment in Illinois by using policy to leverage funding to advance infant and early childhood mental health consultation, and learn from you all in this room as well. And where am I going? I'm on this journey with you to learn, grow, and to practice humility, seeking to be a better champion in anti-racist practices and challenging the way things have always been done. And with that, I turn it back over to Allie.
Thank you, Christine. I don't know why it keeps not letting me advance my slides. I think whenever I click off, I will try not to do this every single time. There we go. So my name is Allie Lofotis, and I am a policy manager with our Illinois policy team at Start Early. I identify as a white cisgendered woman. I'm a daughter, a sister, a wife, and mother. I started learning Spanish in elementary school and continued it throughout my education and study abroad experience, using it when I worked in direct practice. Where did I come from? I'm from a small town in North Carolina and still have family there, but I've lived in Colorado and China. I've also studied abroad in Mexico and Turkey. I moved to Chicago in 2005 to attend grad school, loving the city, and so stayed here to put down roots and work. I work in policy, but my background is actually in clinical social work, and before making the switch to policy, I always worked in direct practice and early childhood programs, doing everything from case management to family support work, consultation, therapy with kids and families, and also supervising a teen parent home visiting program. I feel like my policy work is directly informed by my direct practice work, and I use a lot of my same clinical skills when I'm in my policy work. Throughout my life and experiences, I have gradually come to learn about discrimination and oppression, power and privilege, and the importance of cultural humility. My more recent work on expulsion created another shift in personal transformation in me around my own biases and thoughts about equity. I always thought that I was open-minded, but over the years came to realize that I fell more in the camp of being colorblind, which is a conceptual fallacy. We all have biases, and as humans, we need to recognize them. I feel that I am an equity champion, and my professional work facilitating conversations about it is closely aligned with my personal life and deeply held convictions about humanity. And why am I here? I've been working on a statewide effort to grow and sustain consultation in Illinois for many years, but apart from that formal role, I believe in the importance of supporting and promoting infant and early childhood mental health, which includes supporting the mental health of the caregiver, the family, and the community, and that consultation is an effective strategy and support for staff and programs. And where am I going? I'm still on my journey of learning what I bring to the work, what my role is, and what my lens is and my biases are. I constantly ask myself, when do I sit back and listen, and when do I speak up? I feel like we all on this work, and it's just as much my duty to speak about it as anyone else's. And I'm honored to be presenting to you along with my co-facilitator, colleague, and friend, Christine. So we have a quick poll. We want to see where you are, who you are in the room. If we can launch that, and we'll give folks a few seconds to answer that.
Ellie, the poll's having a trouble starting. One moment.
Okay, is it because I'm sharing?
No, it shouldn't be.
Okay.
And a few people are identifying themselves in the chat as an advocate, consultant for state agency, consultants. And so thank you all for just doing what consultants do, which is just dive right in. And so thank you so much for helping us understand who else is in the room.
And being flexible.
Mental health specialist. Early childhood mental health program administrator, policy advocate and consultant. There you go. You found your twin somewhere out there, Ellie.
Right.
Other infant early childhood mental health program manager also in the room.
Okay, we'll give folks just a few more seconds. Looks like the answers have slowed down a little. All right, I'm going to go ahead and close it out. Looks like the majority of you are consultants, although I'm wondering if people could choose more than one response, but looks like we have a good mix of folks in the room, so that's great. And here it goes again. 1 second. I'm sorry. Every time I click off, it does this again. So again, thank you for being flexible. So where did we come from? I am going to very quickly go through Illinois' timeline journey. I'm not going to go over every single one of these. These are in the slides for you to reference later, and we've linked to things as much as we can. So obviously there are things before 1981, like Head Start and Early Head Start. And, you know, this is not an exhaustive list. You can actually find an exhaustive list in the Irving Harris Action Plan, which we'll talk about later. But we do have some highlights, recent highlights that have led us here today. In 1981, our Infant Mental Health Association was established. In 2002 and 2003, the Illinois Children's Mental Health Act was passed, creating the Children's Mental Health Partnership. In 2005, social emotional consultants were added to our early intervention system at each of our child and family connections regions in the state. In 2006, mental health consultation was established in our state-funded Birth to 5 programs through our State Board of Education. In 2008, consultation was further embedded and expanded within childcare. And in 2009, consultation was established in home visiting programs, and our state began reflective learning groups across the state. In 2013, the association awarded the first credential to the first group of practitioners. 2014, I mentioned the Irving Harris Mental Health Action Plan, and that is the actual very long title of it, which is basically launched in 2015, the creation of the Mental Health Consultation Initiative that established and piloted an Illinois model of consultation. In 2017, we passed our Early Childhood Expulsion Legislation, which I'll talk more about later, and our Pyramid Model Initiative was launched. And then a team from Illinois also began participating in the 0 to 3 training and technical assistance cohort around financing for infant and early childhood mental health services, which lasted through 2020 and actually is kind of still informally going on and is evidenced by some of the work that Christine and I are talking about here today. Our little team is kind of like informally still going on. In 2020, the consultation pilot evaluation report was published. And then in 2021, we had another big year with our Education and Workforce Equity Act that was passed. And we will talk extensively about that as well. So Christine.
Thank you, Allie, for that. And so the next slide, you'll see a brief slide describing our system of infant and early childhood mental health consultation. And the pilot evaluation that Allie alluded to and is also presenting at this conference as well, if you have a chance to check them out, created what was known as the initiative to help drive this pilot evaluation. Since the pilot is done and it has wrapped up in 2021, we've since transformed into more of a leadership team. And under that leadership team, we've also recently completed a strategic plan to help guide our work forward. And that strategic plan wrapped up in the fall of 2021. And one of the things that we really wanted to create a shared understanding around was to share what our vision is for the Illinois system of infant and early childhood mental health consultation. And so our vision is that Illinois early childhood professionals and programs receive effective infant and early childhood mental health consultation, building their capacity to improve emotional well-being for children and the adults around them. And so we also included this visual for you so that you could see the different sectors and programs, early learning programs with which mental health consultation is embedded in the state of Illinois. So it can be found with supporting childcare providers in early intervention as our social emotional consultants, in early Head Start in the Illinois State Board of Education funded early learning programs such as Prevention Initiative and Preschool for All and Preschool for All expansion. And it's also supported in home visiting funding through MIECHV, as well as the Department of Human Services funded programs. So with that, I turn it back over to Allie.
Thanks. And we'll talk a little bit more about that legislation I mentioned. So first, I want to talk about our early childhood expulsion legislation, which prohibits expulsions of children aged 0 to 5 in school and community-based early childhood programs receiving either the Early Childhood Black Grant funding from our State Board of Ed. So as Christine mentioned, our Preschool for All and Prevention Initiative, but also licensed childcare centers and homes serving children birth to 5. And then of course, Head Start and Early Head Start programs, which already prohibited expulsions. The legislation specifically names resources that should be utilized, including consultation with a consultant. It names specific trainings that should be provided, such as promoting social emotional development and behavioral health, how to address challenging behaviors, how to understand trauma and trauma-informed care, cultural competence, which I wish at the time we had named cultural humility, but it's okay, with things change. Family engagement with diverse populations, the impact of implicit bias on adult behavior, and the use of reflective practice techniques. It also says that support should include the availability and resources to contract with infant and early childhood mental health consultants, and requires funders and programs to track the usage of consultation. However, I do want to point out that this legislation was not accompanied by any additional funding, which we'll talk a little bit about later too. Then we've talked about the Education and Workforce Equity Act. So our Illinois Black Caucus introduced and passed it in the spring of 2021. And then the governor signed it into law. And the Governor's Office of Early Childhood Development, where Christine is utilizing GEARS funding, which she'll explain, to support and drive this legislation. It signifies broad public support for providing social emotional strategies and supports that are just as important as learning your ABCs for our state's youngest learners. We know that the pandemic has really amplified the number of kids who have experienced childhood trauma and highlighted pre-existing inequities in school disciplinary practices that disproportionately impact Black and Brown students as young as 2 and 3 years old. So it doesn't have to be school-based either. It can be in childcare, early learning programs. Access to infant and early childhood mental health services is really critical to ensure the social and emotional well-being, and particularly of those kids who have experienced trauma, and also the workforce that cultivates the child's love of learning outside the home. So the governor approved the use of GEAR 2 funding for elements for the Public Act that call for the support of across the continuum of infant and early childhood mental health. So the legislation asks that the state increase the availability of consultation through increased funding in early childhood programs and sustainable funding for the coordination of consultation and other social emotional supports at the state level. The state agencies will develop and promote provider accessible and parent accessible materials on the role and value of consultation, including targeted promotion in underserved communities, and promote the use of existing consultants and the consultant database and other services. There's also increased funding for tiered systems of support, such as the pyramid model. And then it also established the use of the DC 0 to 5 in the instance that a diagnosis is needed for a child aged 0 to 5. So that's not our primary focus of this presentation today, but I just wanted to highlight some of the additional things across the continuum of infant and early childhood mental health that this legislation supported.
Thank you, Allie, for that overview of some of the exciting legislation that you and colleagues have been able to push through. And this was not something that happened overnight. It was definitely a labor of love to get it over the finish line. And so I'm so grateful for your advocacy and partnership so that we can have something on paper as we continue to advocate for our system integration and sustainability efforts. So with that, we wanted to jump into the next poll, and we wanted to review with you what are some of the options and explore with you, how are you all funding mental health consultation in your states? And so we recognize, unfortunately, with this poll, you can only select one, but in Illinois, we know we are funded by more than one funding stream. So if one just pops out at you, please feel free to share that with us. But is mental health consultation funded in your state, tribe, or territory by the Childcare Development Block Grant, Community Mental Health Services Block Grant, Substance Abuse Prevention and Treatment Block Grants, Title V, Maternal and Child Health Block Grant, Title IV-B, Child Welfare Services, and Title IV-A, or is it funded by IDEA, Part C and Part B, or Medicaid? So we're at about 52% participation rates. So we'll give that about another 10 more seconds or so. So we are seeing a pretty good uptick. Okay. All righty. So it sounds like we have the majority of you all have participated. And so the most popular response was that most of you all are funding consultation through your Childhood Development Block Grants. And then the next popular one is actually through Community Mental Health Services Block Grant, which is exciting for us to hear about. So thank you for that. So as we delve in, we wanted to share with you a little bit more about our Illinois systems and how we support that here. So in Illinois, we use a combination of public and private funding that's outlined on this slide. And philanthropy was essential for us to really get this initiative off the ground. If it were not for them, we wouldn't be able to pilot and to convene individuals to really think about what would this plan be for Illinois and how could we see this through. And so philanthropy helped to get us to the table, and some of those funders were an anonymous funder, Caregiver Connections. Some of the supporters include the Illinois Children's Healthcare Foundation, the Irving B. Harris Foundation, McCormick Foundation, J.B. and M.K. Pritzker Family Foundation, the W. Clement and Jesse V. Stone Foundation, and this project was also funded in part by the Tellegen Community Initiative. Some of our state funding comes from the Illinois Department of Human Services, as well as the Illinois State Board of Education. Some of the federal funding comes from MIECHV, the Maternal, Infant, and Early Childhood Home Visiting Grants, as well as Early Head Start, and Early Intervention through IDEA Part C. And also previously as a state, we tried to get it written into the 1115 waiver a few years ago, but unfortunately it was not approved federally. However, another thing we learned was that about 3 years ago, the Mental Health Consultation Initiative, formerly, the leadership team was formerly known as the initiative, went through a cost modeling exercise to try and determine the true cost to the state to fully fund and support the consultation workforce if it were scaled for our programs across the state, as well as thinking about what were some of the infrastructure components that are needed to really help get this off the ground. It was a groundbreaking exercise that many national experts in other states continue to follow. While it wasn't perfect, it did lead us as a state to be able to pivot and seize opportunities, which led to GEAR, PDG, B5 funding, and move from piloting and previously doing this work and funding it differently in silos and moving us closer towards sustainability. Different funders, such as program embedded, and close contracts with DHS, the Department of Human Services, versus an open amount funding, as is from the Illinois State Board of Education, Early Head Start, such as there's not really a dollar amount or allocation that's limited by the State Board of Education or Early Head Start. They just say that we are highly supportive and encourage you to add mental health consultation into your contract, but they don't say that you have a certain limit of 10,000, 15,000 that you're restricted in your contract. However, early intervention is limited to the number of cases that are at the CFC, which determine how much funding gets allocated towards the social emotional consultants that are based at each CFC. So with that, the cost model continues to be updated even to this year, and it continues to reflect current investments in infrastructure and some of the sustaining program enhancements that we've been able to test with some of our federal funding. So more specifically, with this slide, we wanted to share a little bit about how this public-private partnership has existed in our states. So for example, the Governor's Office of Early Childhood Development, my position as well as another colleague is funded by federal funding. And there are a couple initiatives that are under this project. So as Ali alluded to earlier with the legislation, because we had the Infant and Early Childhood Mental Health Consultation Act, and because we also had this opportunity with federal funding, we were able to make a case for some of these projects and initiatives. One of them included promoting public awareness of infant and early childhood mental health consultation to families and providers across the communities that have had fewer programmatic resources. Thinking about family child care centers, or maybe some communities in the state that have maybe more rural communities. Another thing that we've been able to do is to we've been able to double the mental health consultants available to support child care programs that's offered through our state entity, our state program, Caregiver Connections, for free for child care programs. We've also been able to lead and have DC 0 to 5 clinical trainings in Illinois, and also support a training of trainer cohort so that we can hold on to this infant and early childhood mental health knowledge, expertise, and approach to diagnosing and understanding developmental delays for young children that is developmentally appropriate. We've also, because of the pilot evaluation, understood that we need to continue to invest in the early childhood workforce and support supervisors in their capacity for reflective supervision. So with that, we've been able to invest in another training of trainer cohort to embed that reflective training component for the Illinois Head Start Association, as well as child care supervisors. And then in addition to that, we recognize that mental health consultation needs to continue to learn and to evolve and to enhance their set of learning and knowledge and expertise. So we've also allocated funding to develop curricula to train on the impacts of trauma on child development. Our private partner, INCRA, the Illinois Network of Child Care Resource and Referral Agencies, really houses some of our professional development infrastructure. And so part of that includes an orientation to the Illinois model of infant and early childhood mental health consultation. With that being said, as you will be able to recall from the previous slide, mental health consultation in Illinois actually lives across various funders, from the State Board of Education, the Department of Human Services, to early intervention, to Head Start. And so part of that really requires that we have a common understanding of what mental health consultation is, so that programs, when they access and write into their grant for consultation, they really have this really full nuanced understanding, and there's fidelity to what the Illinois model is. They also facilitate quarterly calls with mental health consultants. We recognize that in the past that most consultants kind of got their information from word of mouth. And so when we facilitate these quarterly calls, they're able to hear directly from state leaders, professional development entities, what's going on at the state, and also have a shared space where they can connect with other consultants that are doing this work across the state of Illinois. We also fund reflective learning groups, recognizing that in Illinois, we have not only program embedded, but independent consultants. And so we wanted to provide that shared space where individuals could share and exchange learning across their groups. And then we also have the statewide consultant database that was also launched earlier in 2021 that now has 100 consultants listed representing the state of Illinois. So on the next slide, just very briefly, I wanted to show you an example of what support some of our collaboration has looked like. We co-created this guidance document for the Illinois State Board of Education. And so as you may remember, through ARPA funding, the American Rescue Plan, there was a significant amount of funding that went towards school districts that would promote learning renewal efforts across the districts and across the state. So with this document, we wanted, as you'll also recall, the Illinois State Board of Education is a funder of mental health consultation. So in these efforts to promote social emotional learning and experiences and reinvigorate a love of learning, we wanted to make sure that mental health consultation didn't just fall by the wayside. It wasn't something that was just lost or overlooked as we focus on the K-12 learning experiences. So we co-created this document in collaboration with our principal consultants at the Illinois Illinois State Board of Education to ensure that we emphasize that consultation is an allowable expense. It provides job embedded professional development, but this was that opportunity where then ISB then sent it out in their superintendent's newsletter. So it got to the decision makers and those that were creating budgets and deciding how much to invest in mental health consultation. The next document was also co-created with the major funders of home visiting in Illinois. So as you'll see, we have the logos up top with the Department of Family Support Services in Chicago, the Illinois State Board of Education, the Illinois Head Start Association, iGrow, Illinois Department of Human Services. And again, this was a joint statement that said, regardless of funder, that we are united. We recognize that mental health consultation is a key component to supporting our home visiting programs. And again, it has that shared language, that shared accountability, that shared agreement that we are all on the same page and that we are hoping to promote job embedded support. We recognize that this is a critical lifeline when it comes to supporting your workforce and retaining them. The next slide talks about, and I will just transition it over to Ellie.
Thanks. Yeah, we're really trying to make a concerted effort to address equity, and inequities exist, due to structural, historical, and systemic oppression. Disparities exist for children and families due to stigma related to mental health, but also bias and oppression and access to and engagement in services for certain populations. Disparities exist for the workforce as well due to lack of outreach and engagement to develop the pipeline, access to professional development, both pre-service and in-service, that advances career pathways and is culturally congruent, and finally, undercompensation. Funding also creates inequities when different funding streams and amounts create differences in what types of programs have access to certain things. So in Illinois, we're really trying to focus efforts on the recruitment, training, and support of BIPOC consultants and supervisors as ways of growing and sustaining a diverse workforce, as well as how they have been training their white-bodied workforce in active anti-racist work. And so first, we're trying to get a sense of who our workforce is. The data isn't perfect. We know we've never captured the full universe of our consultant workforce yet, although we're getting closer. You'll see in the next few slides that our data collection points across the years have not been the same, which makes it really difficult to get a clear picture. 2015 was when we did a first scan of the workforce. The consultation initiative created a survey and we sent it out as far and wide as we could through our known networks, but we're also trying to capture folks we may not have been aware of. 90 consultants responded. And then in 2020, the Irving Harris Foundation conducted a survey specifically to understand the impact of COVID on consultation practices, but we were able to collect some demographic information in that survey, and only 16 consultants responded to that, so it was a little bit smaller. But then in 2022, as Christine mentioned, we have our current consultant database where we're able to pull demographic information from, and that now has over 100 consultants on there, or about 100. So starting with gender identity, in 2015, 90% identified as female. In 2020, 97 identified as female. And again, in 2022, 90% as female. Moving into race and ethnicity, sorry, these are kind of small. You'll see that our categories don't match from year to year. So again, it's really difficult to compare. In 2015, you can see that our workforce was predominantly identified as Caucasian or white. You'll notice on this graph, it appears that we don't have a category for Hispanic Latino, but that's because we actually asked an entirely separate question first of, are you of Hispanic or Latino origin? And I just don't have that slide there. But the response was 84% no and 12% yes. Also, there were two other categories that were options. So American Indian, Alaskan Native, and Native Hawaiian and Pacific Islander, but those, there were 0 responses logged for those two categories. So I don't have them indicated in that pie chart. Again, in 2020, you'll see that our workforce, again, was predominantly still white. And in 2022, you'll see that, again, they're still predominantly white, although you'll see that there appear to be more consultants of color overall. However, I'm not sure if that's attributable to an increase in recruitment efforts, or if we're just finding people and asking people who were already there and they just weren't previously captured in the data. Here's language, and this was actually one of the trickiest things to put into a chart, which is why I only have these two. because in 2015, we actually separated this out into 2 questions. First, we asked if they spoke a language other than English in their work, and only 19 responded that they do. And then of that 19% who do speak a language other than English, 22 people answered which language. 73% spoke Spanish, 9% spoke French, 5% spoke Mandarin, and 18 chose other. And of the other category that listed Portuguese, Italian, and Yiddish. And then 5% preferred not to answer. Other language options that were an option, but no one chose an answer to, were things like Cantonese, Urdu, Polish, Arabic, and Tagalog. We listed all of these languages because, according to other data sets, many of our families in Illinois use these language in our programs. However, according to the answers on our survey, our consultants don't. In 2020, that survey, we actually didn't ask a question about language, so I don't have any data there. And then in 2022, you'll see the current database language categories in the data. And actually now we are capturing American Sign Language as an option that some consultants do use in programs. In Illinois, we're a big state with a range of urban, suburban, and rural areas. And again, this data is not easily comparable because we didn't categorize things the same across the years. And I don't have a fancy image for the 2015 map. But as for the most recent accounts in 2022, Cook County, which is up in that corner and is basically Chicago and the collar, or the whole county, it's the top with 58% of consultants. And then the suburban collar counties around Chicago of DuPage, Kane, and Will counties coming in together at about 49%. And then in DeKalb County, which is a county in northern Illinois, that comes in at 16%. But all of this workforce data that I'm throwing at you is basically to show that we are trying to get a better place at collecting and analyzing our workforce in order to address equity issues.
Thank you, Allie. And I will elaborate as well. On the past slide, you could see this increasing shading across the state of Illinois, right? Where we went before, we just assessed kind of vaguely where people are located across the state. And then in 2020, you see a significant amount of the state that is white or absent of color with the shading on the middle map. But then in the last map, you see very nearly entire state coverage and shading and grading, indicating that there is coverage of mental health consultation across the state. So with that, on the next slide, sorry, Allie, I was taking us back. We wanted to show and explore a little bit more about what equity looks like in action. So part of the Illinois model of the infant and early childhood mental health consultation pilot included specific Harris tenants training during the first orientation cohorts. And then as a result of that, a module was developed discussing diversity, equity, inclusion, and belonging that is part of every single orientation. And that orientation does offer about 19.75 CEUs. I hope it's up to 20 at this point, but it offers 20 CEUs. And then there is also now launched, I guess since we created this slide deck, there is an official diversity, equity, and inclusion and belonging on demand follow-up module, which is outside of the orientation. Now consultants have access to this on-demand module that is a more intensive conversation for 2 hours with guided reflections, surveys, questions to help ascertain and check in on your knowledge and strengths that you've learned in the course of this module. And then in addition to that, there's also the Infant and Early Childhood Mental Health Consultation Public Awareness Campaign that I previously mentioned. And so we will be creating a series of one-pagers as well as videos that are available in multiple languages, just depending on the targeted audience. And then the Infant and Early Childhood Mental Health Consultation team does continue to have not only a subcommittee, but a coordinating body of diversity, focus on diversity, equity, inclusion, and belonging. And the specific goal of that is that this isn't just one offshoot of a subcommittee that just owns the work. It really has representation across all of the other subcommittees to ensure that when you're looking at workforce development, what does diversity and equity look like in that work? When you're looking at data, what does diversity, equity, and inclusion look like? What are the questions we should be asking? What does the data tell us? And then also thinking about our efforts with the public awareness campaign and how we can be better about offering services in multiple languages, including reaching out to some of our other diverse communities throughout the state of Illinois. And so we are continuing to look at efforts and really explore how we are able to train not only the workforce, but the leaders of the workforce. And so we have also previously partnered with consultants and convened stakeholders to really explore how we could be better and think about what intensive trainings and professional development do we need to support and give to the facilitators of the reflective learning groups, those that are the presenters during the orientation model, so that we can ensure that we're continuing to be responsive to the needs of the field. Next slide. And specifically in regards to the legislation and state response. So as it's stated more specifically in the Infant and Early Childhood Mental Health Consultation Act, it encourages the Governor's Office of Early Childhood Development to develop, promote, provider accessible and parent accessible materials. So that is directly, again, because it was in legislation, we were able to then say that when we had this influx of federal funding, to say we need to meet the letter of the law, and we need to invest in this public awareness campaign to ensure that mental health consultation is offered and available equitably across the state of Illinois. And it also encouraged opportunities for GOECD to coordinate and develop strategies to provide outreach to support providers in underserved communities with fewer programmatic resources. And so this continues to be something that GOECD owns at this point, and it's specifically creating that accountability mechanism so that we are continuing to respond and think about equity and how are we reaching out to our communities across the state of Illinois. And for the next slide, I turn it back over to Allie.
Yeah, so let's go back to the beginning. Who are we? Where did we come from? Why are we here? And where are we going? And looking at some lessons learned. At the systems level, we must also always use the consultative stance and be reflective. So that's not just a direct practice thing. We have to listen, analyze what we're doing, adapt, and make improvements. Legislation and policies, they're only the starting point, so a very important one. But as rooted in best practice and intentional as a policy can be, it will impact people in different ways, have unintended consequences, and its effects may change over time. You know, what works now may not always work as systems change, funding changes, communities change, and people change. So again, a reflective and systemic approach must be used in policymaking, and there's a need to couple that with increased investments in our access to supports. So for the early childhood expulsion legislation, we actually have a partner in Dr. Catherine Zinzer and her team at the University of Illinois, Chicago. They've been conducting a process evaluation and surveying programs about their expulsion practices, but particularly asking questions of their usage of consultation. Her research has served as a type of proxy data collection for the state while statewide data collection efforts are being established. And her research has greatly informed our implementation, our rulemaking guidance and best practices, not to mention being able to advocate for that additional funding for consultation. And she also is presenting at this conference with a poster session, so you can see her information there. However, our question now as a state advocates is ensuring that we're not kind of stagnating at that state level on data collection efforts and not fulfilling our responsibility from the legislation to collect and report data versus, relying on external research. And so I'll hand it to Christine to talk more about the pilot evaluation.
Mm-hmm. So very quickly, we did want to just briefly mention with the Illinois model pilot evaluation. And so this continues to inform our work. We've been able to look at the lessons learned and what were some of the shortcomings and maybe some opportunities where we can benefit from increased enhancement of funding, such as supporting the reflective supervision practices and investing in the FAN model of reflective consultation in the training of trainers. So with that being said, we wanted to ensure that this is also something that continues to be responsive. We continue to have, they are also presenting at this conference as well, but we're ensuring that we're constantly reflecting on the lessons learned and where we're continuing to go, and we continue to use it for sustainability efforts to continue to make the case for investing in comprehensive infrastructure so that we can ensure that there's fidelity to the model across programs regardless of funder. And then in addition to that, just with the Gateways Infant and Early Childhood Mental Health Consultation database. So we did include the links throughout the PowerPoint for your consideration. So you can always go back and learn more information and just check it out to see what is the information that you might be able to learn from it. And in addition to that, we were able to see, and there continues to be tweaks, understanding some of the shortcomings and where we can improve our data collection efforts to get a better understanding. So when funders ask us, well, how many consultants are available to Preschool for All programs? And one of the nuances here in Illinois is that a consultant such as Allie might actually be a consultant to a Head Start program and a Preschool for All program. So it's really hard to de-identify some of that data when it's understanding that many of the independent consultants that we partner with are actually available and support various programs and funding streams. And then, as I mentioned, while we were so excited to get to be able to leverage federal funding to hire to double the amount of caregiver connections consultants, one of the workforce challenges, as many of you all are hearing, is definitely we are experiencing those same hiring challenges. How do we understand that? How do we really know if someone has that right secret sauce of both early childhood development, but then also the clinical orientation, but then also having that past experience of working with children under the age of 5. And so we are continuing to work through that. However, one of the bright notes is that with that initiative, actually well over half of those consultants that have been hired with that Caregiver Connections expansion have been persons of color, which continues to educate us and to provide us new opportunities of where we might be recruiting from institutions of higher ed, partnering with some of our community partners, and really thinking about our intentional recruitment efforts for the consultant workforce. So with that, I think that's about it. And so we have our contact information for Allie and I. If you have more information, we are always here to help, to answer questions or direct you to the right person. And so with that, I will.
I'm going to stop sharing my screen. Our contact information will definitely be available on the slide, so you can have that. But I believe our moderators have been monitoring the chat, so I think we have some time for questions.
So one of the questions was, any suggestions or websites to find out what type of funding our state uses for early childhood programs? So I'm not sure if this is early childhood programs in general, or are you saying consultation to support early childhood programs? Alina, would you be able to elaborate a little bit more?
Allie, are you able to continue?
Yes. So I mean, we know in Illinois what is available, what funding is available, and what our state uses. And we, you know, as Christine mentioned, we have an orientation where we go over different funding streams for consultants. We're actually planning we have an annual retreat for our consultants, and one of the sessions will be kind of a state of the state, and it will kind of overview some of these things as well. I'm knowledgeable of some funding streams in other states and how they structure it, but I know like the Center of Excellence keeps track of a lot of that from state to state. So does 0 to 3. And so they've published quite a few briefs on state highlights and examples of different states and how they are funding consultations. So those are good resources to start with. And then I think once you kind of find out who's kind of running the show in your state, then it would probably be kind of getting on those committees or getting the ears of those funders and state agencies that are doing it. Here in Illinois, we're lucky that Christine is kind of the coordinator of all the funders, and that's a tricky spot to be in because they're not beholden to her or anything, you know, but she's great at collaborating and working with people and getting people to come to the table. So you know, but I recognize not every state has that. I don't know, Christine, do you have anything else to add? to that.
And I think even when you think you have an answer, someone else that works for the same entity of the Department of Human Services, it's huge. So it's hard to get maybe one specific line item, but that's also why we put in the poll. And Allie alluded to 0 to 3 has some resources of how different states have funded it. And so sometimes it is just dependent on who is the leader and how they envision mental health consultation supporting their programmatic goals. So I think that's one of the things that is something for you to look into to figure out maybe which leaders are a little bit more friendly. And there is a significant amount of issue education that has to go into this. So if it wasn't for Allie just constantly meeting with these funders and philanthropy, just asking the funders and state leaders what they think about it, or what about mental health consultation, this is one of those things where you continue to be the squeaky wheel that gets the oil, and really think about those opportunities to advocate and explore how to make the case how mental health consultation can really support child and family outcomes, but then also be an important tool for employee and staff retention that we know is critical for the early learning work.
Yeah, and in some states, its consultation is a lot more clinically focused. And so those states might use more mental health block grant funds or Title V block grant funds, Medicaid to fund consultation. We in Illinois don't draw down those as much. We're trying to move into that a little bit. In Illinois, our workforce, we're very multidisciplinary. We don't require a clinical license to be a consultant. We do require a master's degree and some levels of experience, but not necessarily clinical work and doing clinical practice, although recognizing that some of our consultants might wear different hats. Like sometimes they might actually be doing some clinical work, but when they're a consultant, they're doing this according to the Illinois model.
Perfect. Thank you. I'll look into it more. She says, I'm from California and I'm new to learning about policy and funding.
I'm familiar with like First 5 California and places like First 5 LA. I know they do a lot. I'm more familiar on their work around home visiting, but maybe they would have some information about consultation. And I believe, is it Khadijah Johnston, who's also from California, San Francisco? She leads a lot of consultation work.
Perfect. I'm going to add something in the chat right now on some resources, and we'll take a look and see if there's any other questions. It looks like that is all the questions we have coming in right now, right up to the exact time of the end of the session. Allie and Christine, thank you so much for that great presentation. We really appreciate it. Attendees, make sure you complete your evaluation, and we'll see you on the rest of the conference. Thanks so much.
Thank you so much
for your time.